I chose school nursing because I like to make a difference not only in the lives of the children I serve and their families, but my whole community. I have an opportunity to teach chronic disease.
On a typical day in every community, 1/5 to 1/4 of the population is being managed in the school setting. And no other specialty profession is as uniquely qualified and suited to manage the daily health needs of the students as a registered professional nurse.
And the most challenging part of being a school nurse is recognizing that you're an apple in an orange field and still trying to work with people who, first of all, want to tell you what your job is because they know better than you, and second of all, people who don't really know what you will do and don't include you as part of the team. So those are the most challenging aspects, and after a while you learn how to work around and work with all of the people that you work with. Thank you.
I have an opportunity to teach basic care, things that some parents just don't know and they don't think about. They don't know how to control a fever or what to do for an earache. Sometimes they panic over the smallest of things like a rash.
What I love most about being a school nurse is seeing families grow up. I realized this year that I had a student of one family for the whole 19 years that I've been a school nurse. And I love seeing them graduate from high school, love seeing them in the community, and most of all, I love knowing that what I do helps the teachers be able to teach because they don't have to worry about the health needs of the students in their classroom.
The registered professional nurse is also the most suited to respond to the occasional emergent situation that will definitely occur over time.
And it's nice to be there for them and get to be that resource, that person. Sometimes for some of these kids, I may be the only medical provider they see.
What I love about being a school nurse is being a part of the future. It is an opportunity to advocate and to teach children how to advocate for their needs into the future, and school nurses make a difference.
I'm Cathy Couture. I'm a Boston Public School nurse, and how I impacted a child's life. There was a 4th grade girl that I helped, and she repeated. I did a lot of different things for her. She also came back. I helped get her a job in the after-school program. Then I helped her get into a college. I went to the college with her, and now she's 2 years into college, and she still checks in. And so I think school nurses can be a presence, a constant presence in kids' life. And that's why I think it's real important when we stay in one place for a long time. Thank you.
My name is John Sampson. I'm with Champions for Kids, and I'm not a school nurse. But I am here because a school nurse changed my life. When I was born in Mexico, my mom decided to move to the U.S., and so we moved to El Paso, Texas. Living in a very humble upbringing, we had to rely on a lot of resources in the community. A school nurse in El Paso, Texas changed my life by providing me with the resources that I needed. I remember being in a classroom and being pulled out of that classroom to go to the nurse's office. I didn't know at the time why, and when I got there were boxes full of clothes. The nurse asked me to pick out whatever I wanted from the boxes, and I remember feeling thrilled because there were things in there that I saw my peers wearing. It was a day of excitement for me. I didn't feel singled out. I felt very happy to have clothes and to have things that my peers had. One in particular was a windsuit, which if you are familiar with these things, it sounds like you're starting a friction fire when you're walking down the hall. But I was really pumped because it was something that everybody was wearing at the time and my mom couldn't afford to get me. So that's why I think every school deserves a school nurse, because it's so vital and crucial to the development of our youth.